The second common surgical problem that we face in day-to-day life is hernias. Everybody knows there are various types of the hernias depending upon the area of the body which is involved. For example, if it is in groin, we call it as a inguinal hernia. If it is around navel, we call it as a umbilical hernia. And if it occurs through the cut which was made over the tummy during the previous surgeries, like in case of females, cesarean section or appendectomy, that hernia we call it as an incisional hernia. It occurs through the incision which was taken. So these three hernias are quite common: inguinal hernia, umbilical hernia and incisional hernia. So when we move to the treatment of the hernias are purely surgical problem. We need to treat it by surgeries. There are two techniques. One is again open technique and second is laparoscopy. In both the techniques, the principle of the surgery is same, that we reduce the fat, we reduce the intestines which are coming, we repair the defect and we put a mesh. So the principle in both technique is same, but the approach is different. For example, in open surgery, we give a cut from front, we repair the defect and we put a mesh from front. So it is called as an open surgery or surgery through anterior approach, front approach. Second is laparoscopic surgery. In laparoscopic surgery, we give small cuts, buttonhole 5 mm cuts over the tummy. It is called as laparoscopic surgery. Layman calls it a laser surgery, keyhole surgery or minimal invasive surgery. We make a 3 holes. Through the 3 holes we operate and we put a mesh from behind, not from front. So this is a posterior approach. Now obviously we have certain advantages of laparoscopic surgeries over the conventional surgeries. It is minimal invasive, the scar is less or no scar, there is minimum pain, patient can be discharged earlier, patient can resume his activities as early as possible, and the chances of infection are less. And if we see the result, again the laparoscopic surgery repair results are better. Now we'll just have a look over the instruments which we use for the laparoscopic. So this is a set that we use during the laparoscopic surgery. So we have seen the set of laparoscopic surgery. Again, in laparoscopic surgery, we have gone one step ahead, that is advanced laparoscopic surgery. In conventional laparoscopic surgery, what we do, we make a hole through all layers of the tummy. We go through and through into the tummy. But in advanced laparoscopic surgery, we enter through the few outer layers of the tummy and we create a plane and we repair the hernia. So what is the advantage? It is a natural plane of the body through which mesh can be fixed well. It fits into a physiological mesh, and in that case also we don't use stapler pins or we don't use the tacker's pin to fix the mesh. Here I have some important things that I will show you. This is a glue. In our case, we don't use pins, we use this glue. This is a simple tube. We pass through this hole and we push the glue, and that glue fixes the mesh into the physiological plane. Advantage, definite advantage is few patients experience pain due to the pins after the surgery, but in this technique there is no pain after the surgery due to fixation of the mesh. Second point that we use a 3D mesh. So a 3D mesh is nothing like, it has no 3 dimension, but its contour is convex, that it properly fits into the convex contour of the tummy. So this is an obvious advantage of 3D mesh. Now if we this technique which we use, which is one step ahead of the conventional laparoscopic surgery, is an extended total extraperitoneal approach. An advantage, as I told you, we use glue, so there is no pain after the surgery. We use 3D mesh which fits properly, and we use the different approach through the total extraperitoneal approach. So when the mesh is fixed, the chances of occurring hernia after surgery are very minimal as compared to conventional laparoscopic surgeries. So in laparoscopy also, the technique we use is an advanced laparoscopic surgery, that is extended total extraperitoneal approach, which is a far different than a routine laparoscopic surgery, and we do prefer this surgery because of very minimal recurrence rate, less infection and rapid recovery of the patient. Thank you.